the pterygoid plates, the medial aspect of the lateral one and the lateral aspect of the medial one. Also, from this corner of the maxilla, the tuber. The fibers of the medial pterygoid muscle run downwards, backwards, and laterally. They insert here along the inner aspect of the angle of the mandible. Before adding the next muscle, the temporalis, to the picture, we'll put the coronoid process back in place, since that's where the temporalis inserts. Here's temporalis, the largest of the muscles of mastication. It's shaped like a fan. The temporalis arises from the wide area on the side of the skull that lies within the temporal line. The fibers of temporalis converge from above and from behind on the coronoid process. They insert on the outer aspect and the inner aspect of the coronoid process, and also here on the anterior part of the ramus of the mandible. Now we'll put the zygomatic arch back into the picture. The temporalis muscle lies inside the zygomatic arch. Near its insertion, the temporalis is a thick muscle. It occupies the whole of the infratemporal fossa. The temporalis muscle is covered over by this dense layer of deep temporal fascia. The fascia is attached to bone along the zygomatic arch and all the way round the temporal line. Lastly, we'll add the masseter muscle to the picture. Here's the masseter. It's a thick, powerful muscle. The masseter arises from the anterior two-thirds of the lower border of the zygomatic arch on its outer aspect, and from the whole length of the arch on its inner aspect. The fibers of the masseter muscle that arise on the outside run downwards and backwards. Those on the inside run straight downwards. The masseter inserts into this wide area on the angle and ramus of the mandible. The masseter muscle on the outside and the medial pterygoid muscle on the inside converge on the angle of the mandible in very similar ways. Now, let's take a look at the actions of the muscles that we've just seen. The action of closing the jaw is performed by the upward pull of the temporalis, the masseter, and the medial pterygoid muscles. Opening of the jaw is brought about partly by the force of gravity, partly by the forward pull of the lateral pterygoid muscles, and partly by the backward and downward pull of muscles we'll see in a minute that act by way of the hyoid bone. We've not yet seen the two accessory ligaments that restrain forward movement of the mandible. These are the stylomandibular ligament and the sphenomandibular ligament. The stylomandibular ligament goes from the styloid process to the angle of the mandible. The sphenomandibular ligament goes from this small projection, the spine of the sphenoid, to the lingula. Now that we've looked at the mandible and the principal muscles that move it, we'll move on to look at a small but important bone that we haven't seen yet, the hyoid bone. The hyoid bone is a slender U-shaped bone. It's suspended just beneath the mandible. It isn't directly attached to any other bone. You can feel your own hyoid bone here, and you can move it from side to side. Together with its attached muscles, the hyoid bone has two important functions. It holds up the tongue, which sits above it, and it holds up the larynx, which hangs below it. It also transmits the force of muscles that help to open the jaw. Let's take a closer look at the hyoid bone. This broad central part is the body. Its forward-facing upper surface is convex, with facets for the attachment of numerous muscles that we'll see shortly. The backward-facing lower surface of the body is deeply concave. On each side, this long, slender part of the hyoid bone is the greater horn, or greater cornu. The greater horn is attached to the body by a small synovial joint, which gives it a little mobility. This small projection is the lesser horn, or lesser cornu. When the structures above and below it are at rest, the hyoid bone lies slightly below the lower border of the mandible. In the frontal plane, the body of the hyoid is about in line with the last molar tooth. From its resting position, the hyoid bone can be moved upwards and downwards, and forwards and backwards, by the muscles that are attached to it. Now, we'll look at the muscles that hold the hyoid bone in place and cause it to move. There are 7 pairs of them. 2 that pull the hyoid bone upwards and forwards, 1 that pulls it upwards and backwards, 1 that pulls it upwards by means of a pulley, and 3 that pull it downwards. We'll start with the 2 that pull upwards and forwards, the mylohyoid and geniohyoid muscles. Here are the 2 mylohyoid muscles. Between them, they form a continuous sling of muscle that forms the mobile floor of the oral cavity. The mylohyoid muscle arises from the mylohyoid line on the mandible. Most of its fibers pass downwards and medially, joining in the midline with the fibers from the opposite side, all the way from the symphysis of the mandible to the body of the hyoid bone. The more posterior fibers of the mylohyoid insert here on the body of the hyoid bone. The mylohyoid muscle has a free posterior border, which runs straight downwards when seen from the side, also a little inward when seen from behind. Now we'll add the 2 geniohyoid muscles to the picture. Here they are. They lie above the mylohyoid. On each side, the geniohyoid arises from the lower part of the mental spine. It inserts here, on the body of the hyoid bone. Now we'll bring the base of the skull into the picture and add the muscle that pulls upwards and backwards, the stylohyoid. Here's the stylohyoid. It's a long, slender muscle. Just above its insertion, there's an opening in the stylohyoid. The digastric muscle passes through this opening, as we'll see. The stylohyoid arises from the lateral aspect of the styloid process. It's inserted on the base of the greater horn of the hyoid bone. Next we'll add the digastric muscle to the picture. Here it is. The digastric muscle is unusual in that it has 2 bellies, an anterior and a posterior, that are connected in the middle by a tendon. The posterior belly of the digastric arises here, from the digastric notch on the underside of the temporal bone, and from the medial aspect of the mastoid process. The origins of the sternocleidomastoid and splenius muscles, which have been removed in this dissection, lie lateral to it. The posterior belly narrows to a tendon which passes between the 2 slips of the stylohyoid. The digastric tendon then passes through a sling of fibrous connective tissue, by which it's tethered to the hyoid bone here. The tendon then broadens out into the anterior belly of the digastric, which runs almost straight forward beneath the mylohyoid. It's attached low down on the inner aspect of the body of the mandible, just lateral to the midline. Lastly, we'll take a brief look at the attachments of the 3 muscles that pull the hyoid bone downwards. They're the omohyoid, sternohyoid, and thyrohyoid muscles, known collectively as the infrahyoid muscles. Here's the body of the hyoid bone. Here's the upper end of the omohyoid muscle, which goes all the way down to the scapula. Medial to it is the sternohyoid muscle, which goes to the sternum. Behind these 2 is the short thyrohyoid muscle, which goes down to a structure we haven't seen yet, the thyroid cartilage. These muscles insert on the edge of the body of the hyoid bone, the thyrohyoid here, the omohyoid here, and the sternohyoid here. We'll see these three muscles more fully later in this tape.